So there is a call for action. If you have a raised PSA, it's not a death sentence. Welcome back to our tea time chat. Hi everyone, I remain Sinat, your informative prostate specialist, urology nurse practitioner. In our last episode, we talked about the prostate gland, and we described the prostate gland as a very naughty boy. And we said not to allow its bad behavior slide by getting your PSA blood test done. We further discussed about the checklist to prepare you for the test. If you are yet to catch up on the previous episode, go and watch the full video on YouTube. It's still shown on the channel, and it was quite informative. On the video, we have a barcode for you to scan, which allows you to save a copy of this checklist that helps you get ready for your PSA blood test on your phone. So when you scan the barcode, you are able to save a copy of that checklist on what to do, how to prepare for the blood test, the do's and the don'ts before the blood test, and what to expect while getting ready for the blood test, and what exactly to tell your doctor when you get to the point of doing the blood test. Go and catch up on the last episode if you have not done that. And don't forget to subscribe, follow, and share on all social media platforms. And don't forget, it's still March for Men, and it's still the Prostate Cancer Awareness Month. Send this video and share this link with your fathers, your brothers, your uncles, your friends, your relatives, your colleagues at work. Help us save a lot of people. People are dying in silence. Black men are at higher risk of having prostate cancer. Please spread the news, and let's be proactive about it. So there is a call for action. If you have a raised PSA, it's not a death sentence. It just guides us to investigate more on what could be the cause of the raised PSA. We need to be proactive, remember? And we need to be aggressive about this campaign. Black men have higher risk. And guess what? A 10-minute blood test is a price to pay for a 30-year legacy. Isn't that lovely? Just 10 minutes for a 30-year legacy. Now your PSA result is back. It's not the time to panic. First, I want to appreciate your courage for taking the time and taking the step to get the blood test done, which is the first step towards the investigation, which is the first step towards diagnosing this disease. If you've got a raised PSA, you don't need to panic. You don't need to start worrying unnecessarily. There are different things that could cause your PSA to be raised, and we're going to be talking about this in this video. If your PSA is raised, I know the next thing that comes to your mind is the C word, but we are here to guide you through. Your healthcare professional will tell you why your PSA is raised. If you have a raised PSA, there are three things that could cause the PSA. It could be as a result of an enlarged prostate, it could be as a result of infection, or it could be as a result of prostate cancer. However, you remember there is a ladder towards investigating this disease, and here is the ladder. The first step on the ladder is checking your PSA level, which I believe you have done at this moment. And if you have not done that, you are a black man above 45 years old watching this video, please go and check your PSA. It is the first step. It is the first thing on the ladder of investigation in diagnosing this disease. Get your PSA level checked if you've not done it. And if you have done it, that's fine. You've taken the first step, and it's a very bold one. You've done your PSA. The first step on the ladder is the PSA. And if you have done the PSA, that's fine. It's absolutely understandable to feel a bit anxious when you see an elevated PSA. That's the prostate-specific antigen results, and that is the protein produced by the prostate gland, which is normally measured by taking simple blood tests. While some people start to panic and jump on the C word, a high reading is actually just like a traffic light. Just the traffic light on my screen here. A raised PSA, it tells us something is happening in the engine. and the prostate gland needs to be checked to identify what exactly is going on. Remember, we talked about the ladder of investigation towards diagnosing prostate cancer, and you have done your PSA, which is the first step on the ladder, which is actually absolutely fine. A raised PSA, the next step on the ladder is a digital rectal examination. At this stage, we as your healthcare provider, either your nurses, your doctors, we would start thinking about performing a digital rectal examination, which is the dreaded finger examination. That is the finger up the bum test that everyone fears. And I understand it appears and sounds uncomfortable, sometimes embarrassing as well. Some men even say they feel assaulted after the procedure, which is quite understandable. Nobody will penalize you for that. In fact, black men even report significantly more cultural stigma around rectal examination. However, let's remember that black men face significantly double risk of dying from prostate cancer. And we attribute this to genetics, socioeconomic problems, and biological factors. I had cultural bias because a lot of black men don't want to come out because of the fear of the dreaded finger examination, and the test does not start with the finger examination, it starts with the PSA. Digital rectal examination is an invasive procedure performed by trained healthcare professionals, and we understand that this procedure is quite uncomfortable. And I tell you, when I'm in clinic, if I don't need to do it, I don't do it. I do it when the need arises. We understand that it's uncomfortable and it's embarrassing to some men as well. We take care in performing this procedure. The test involves the healthcare professionals wearing gloves and using one of their fingers with a lubricant gel to fill the prostate through the wall of the back passage, that is the rectum, where the poo comes out from. And you can't start to wonder, what are we looking for? What exactly are they looking for? Why are they sticking their hand into my bone? Wait till they find that far. Why are they going invasive? Why are they sticking their hands into their finger into my rectum? No healthcare provider derives joy in doing that. We are also humans like you, and we have blood running through our vein. But this examination helps us to check and feel for any lump, any nodule, any swelling that is on the prostate. Ideally, a prostate should feel just like the tip of your nose. That's the texture of a normal prostate. When we are doing the digital rectal examination, we are checking for the size, the texture, we are checking for any abnormalities. Normally, a normal prostate should actually feel just like the tip of your nose. You see that it's a bit soft. Exactly, that's how a normal prostate should feel. When a prostate starts feeling like the bridge of your nose, you see that this place is harder than this. That's where we get concerned. That's where we start thinking there's something going on. This doesn't feel normal. We start checking for abnormalities. We check for any nodule, like I mentioned earlier. We check for any lump. We check that is symmetrical. It's about the same. We have two lobes on the prostate, and we check that the two lobes are actually symmetrical. So these are the things we examine by doing the digital rectal examination. Nobody derives joy in putting pain or putting a fellow human through pain, but we just need to do this to check for any abnormalities. However, this digital rectal examination, with it, we can't feel the entire prostate. You can only feel about 1/3 to maximally 2/3. If it's a small prostate, you can feel maybe 2/3 of it with your finger. Although abnormalities can be felt on the prostate through the digital rectal examination, but abnormalities are more visible with imaging such as the MRI, which visualizes the entire prostate. Because, like I said, with our finger, we can only feel about 1/3 to maximally 2/3 of the prostate. So the MRI visualizes the entire prostate. However, in developed countries such as the United Kingdom, where people have access to high standard investigations such as the magnetic resonance imaging, that is the MRI of the prostate. So the Prostate Cancer Research UK and the British Association of Urological Surgeons released a statement in June 2025. And guess what they said? They were addressing the effectiveness of digital rectal examination. And the research has actually proven that the digital rectal examination alone is not an effective way to diagnose prostate cancer. Most times, healthcare professionals can't feel the entire prostate. Like I said, you can only feel about 1/3 to 2/3 of the prostate with your finger. So a man with prostate cancer may have a normal feeling prostate or minimal changes that the finger may not even be able to detect. So it has actually come to the notice that the fear of the dreaded finger examination is determining a lot of men from turning up for the checks. So if you don't want the digital rectal examination, you can tell your healthcare provider. Nobody is going to penalize you for saying no. You have the right to actually feel scared, and you have the right to tell your healthcare provider what you want, although we would advise you to have the best kind of care we think is best for you. But in countries like Nigeria, where we have less than 100 MRI in the entire 36 states we have in Nigeria, how do people get access to this high-tech investigation? Even people that even have access to it, how many people can afford to do a prostate MRI? Last time I checked, the prostate MRI is costing between 240 to 300,000 in Nigeria. How many people can afford that kind of investigation? So this is a food for thought. Remember, the PSA is just a protein measured from your blood, and the protein is produced by the prostate gland. So if it comes back elevated, there are 3 things that could cause your PSA to be raised above normal. And I'm going to describe that with this traffic light here. Can you see the traffic light? So the red one indicates it could be prostate cancer, where the amber color indicates it could be an infection, and the green one means an enlarged prostate. So if it's an enlarged prostate, which we called the benign prostate hyperplasia, it's a non-cancerous growth of the prostate and is mostly associated with aging, and that's why it's in green. The infection or inflammation such as prostatitis or any infection that has anything to do with the prostate, this can be treated with antibiotics, and it's in amber. Then prostate cancer, the third cause of raised PSA. That's a cancerous growth, and we need further investigation to confirm this diagnosis, and that's why it's in red. So let's talk about the benign prostate hyperplasia. It's a medical term used to describe an enlarged prostate, where the growth is described as a non-cancerous growth and is mostly associated with aging. As men grow older, their prostate gets bigger, and the bigger the prostate, the higher the level of protein produced by the prostate. So if you have got an infection, if your healthcare provider considers that your PSA level was elevated as a result of an infection or inflammation, they would ask you to bring a urine sample. And this urine sample would be sent to the laboratory, and the urine will be viewed under a microscope. So the microscope will identify what exactly is causing this infection, and they would recommend the appropriate antibiotics to help combat the infection. So after you have finished your course of antibiotics, your PSA blood test will be repeated 6 weeks after treatment. So at this stage, if the PSA level is still elevated, then your healthcare provider will then go to the next stage of investigation. Do not abuse antibiotics. Say no to self-treatment. Prevent yourself from developing antibiotics resistance. If you think you could be suffering from any form of urinary or sexually transmitted infection, visit the nearest hospital to get tested and treated. But our boys, Mudodoyin, Farouk, Shibuzo, no allow shame destroy your shine. And no be excuse. Your staff of office, they do you like say you get sexually transmitted infection or urinary tract infection. Go hospital, make them test you. No go do self-administration of antibiotics and develop antibiotics resistance. So back to our topic. Another cause of raised PSA is an enlarged prostate. Remember the analogy we discussed? The bigger the prostate, the larger the amount of protein produced by the prostate, which is usually measured by the blood test. So if your PSA was raised due to BPH, that is enlarged prostate, then your provider will let you know as well. And this is as a result of increase in the number of cells, and this number of cells makes the prostate grow bigger. You can see on the screen now, this is what a normal prostate looks like, and this is what an enlarged prostate looks like. Can you see the cells on this one is quite bigger than the cells on the normal prostate? So it's nothing to worry about. This matter don't dey serious now, my brothers. This matter don't dey serious. My fathers, Papa Farouk, make we talk. Make una come. Come. Hey. Come here. You see that thing where then they call prostate? Once man don't clock 50, bagam, that thing go start to behave like Nigerian landlord. It go just to dey expand in territory for no reason. Small, the thing go start to dey disturb young boys too. But now senior man like Baba Adija mostly in the show pepper. The matter where they and so imagine say your urethra, that is the pipe where they take pass, where they take piss. It's a small road. Then your prostate can't go block the road. Like you know as last man they take block road. Or police they just create checkpoint for Friday evening. Just where everyone will just block. Now some prostates go just block the urethra. Where you say walak don't bust. Papa Shubuso, you go stand for toilet. 5 minutes, they look wall. They blow whistle, but nothing go drop. You think say fuel don't finish? No, now road block. Prostate don't go block the road. Where urethra supposed to take pass urine for you to wee. Instead, make the water they flow like River Niger and Benue. You go just they drop. Like person when they use dropper give pikin medicine. So if your tap don't turn to dropper, no wait, make road block finally. Your staff of office needs maintenance. Sometimes the prostate go just off. The tap don't completely off. No movement. That one be say you don't enter something where we medical people they call urinary retention. Baba Idaya, if you don't they spend 30 minutes for toilet, just they do small wee. Or you they wake up 10 minutes for night. Like night watchman, like the aboki where they forget. No be juju be that. Your prostate if you don't grow wings. Oga, not be every slow flow be juju. Some we say na BPH, and you know me say na death sentence. Sometimes the symptoms, if they show, sometimes the symptoms go just keep quiet. Just keep quiet. They cause small wahala, small. Some men fit manage them, but for others, it's if it turn your life upside down. You don't fit drive long journey again because you dey find toilet every 5 minutes. Driver abeg, wait, I want peace. Driver abeg, wait, I want peace. Everybody looking for inside bus. Not be only you days for inside bus. You dey wake up for night like night watchman. Come off a tire. Why you dey yarn for office now? You talk say I no sleep for night. Sometimes cold weather, or even when your mind no settle, if it make matter worse. You see that slow wee where you dey pass, na danger. If it lead you to chronic retention, if you no treat am, your bladder fit start to dey feel weak, and you no go empty your wee finish. The water go still remain inside the bladder, and this thing fit cause infection to your bladder, and also if it cause kidney problem. If you no take care, if it affect your kidney. Daddy Iwa, the good news be say your staff of office needs maintenance and treatments dey. Doctors fit give you medicine wey go help you piss well, where the water go dey flow like River Niger and River Benue, where you no go feel like say e dey drop like dropper again. Or they fit say make you do simple surgery for treatment, and we fit pass catheter. The catheter na small pipe wey go help you drain the wee, and go get bag wey if you fit attach am to your leg, wey you go just dey carry waka. So they say you get BPH, no be cancer. Take your mind rest cool. Having an enlarged prostate no mean say na death sentence, and having an enlarged prostate no mean say you don't get the cancer be that. but you fit get the two together. But how we go take know if na cancer you get or no be cancer if you no do the test? That's why you need to do the test. If your papa or your brother don get am before, better carry eye down if e reach your side. As senior man wey you be so, the thing wey I go advise you so be say cut down belle. If you too heavy, sign of good living, or you get diabetes, your prostate fit grow bigger. And eat healthy, a lot of fruits and vegetables. Try dey move your body. Regular exercise is very good. So Baba Adija, Baba Farouk, Baba Chibuzo, subscribe, like, follow and share with all the men wey dey your club. When you dey go club for Sunday, play this video for them, make dem hear. That pipe wey no dey run well, make dem go maintain am. Staff of office needs maintenance. So hi everyone. So we are going to be discussing prostate cancer on the next episode. So don't forget to subscribe, like, follow and share. I remain Sinat, your favorite prostate specialist, urology nurse practitioner. Bye. Cheers. Baba Adija. Bye-bye. Chibuzo, Farouk, Tunde. Don't forget the message where I tell you.